the appropriate food for them, as mentioned, eating from fast foods. And aside from that, although they recognize that they're not eating the right kind of food, is that they're not willing to exercise, they're not willing to leave that old habits.
In fact, I suspect that, the people who decide, from here on I'm going to work out, and then they start going to the gym, it causes them to eat more because they feel they have to reward themselves after an hour of working out by eating an entire pizza.
Guilty.
Guilty. So yeah, everything is connected and people go for the quick fix. The world has gone bonkers. We now live in George Orwell's 1984. War is peace, ignorance is strength, and crazy is normal. How do you stay sane? Dr. Jing Aro is a pediatric infectious disease specialist and medical director. Dr. Jing, how would you rate the health of the average Pinoy?
Okay, so if you're gonna ask me now, I'd say I'll give it from 1 to 10.
Yeah,
10
scale of 1 to
being the highest. It's around 6. So almost passing, but not yet there.
Almost, yes.
Almost passing. If we trace it back for the last few years, we've been doing a lot in improving health services, healthcare. However, Filipinos also change their lifestyle, change their way of how they believe and how they view illnesses. So instead of spending time going to their doctors when they don't feel good about themselves or when they are sick, they'd rather spend their money buying for food, for clothing, or spending for load in the cell phone.
Yeah, and of course eating habits, because a lot of people are now eating fast food.
An average Filipino, they'd rather spend on convenient food. So, like salty food, so those that are would have more calories but less substantial. So,
processed food mostly.
Yes. So, and most of the Filipinos now are career-driven.
Yes.
So, work, more hours for work. So when they go home, there's nobody who would prepare their food. So what would they do? They would order, they would call. So it's easy to order from any fast foods that we have around. So they're not focused on the health, but they're focused on other
the
things.
convenience.
The convenience of
because I'm
food.
hungry, I want it now.
Now, yeah.
And periodically, because I admit I have terrible eating habits, periodically I want to be good. So I said, okay, I'm going to eat more salad. I'm going to try and watch what I eat. But then, if you don't cook, you're at the mercy of restaurants and groceries. And it's very hard to eat healthy in the Philippines, ha?
Yes.
As in,
I agree with you.
I have a friend who was vegan before it became a thing. Na basically he would have to live on rice and ketchup because it was so hard to stick to the rules. And now, I know a lot of people are on the keto diet. And for that, they also have to, they practically have to bring baon because everywhere we go, we are fed large amounts of carbohydrates.
Fats, full of oil or sugar.
Fats and oils are included in keto, but everything we have has sugar and carbs.
So it's a bad combination. Science actually showed that there are some benefits to keto diet. So there's so many fad diets now because people also would want instant. So just realizing that we are not addressing what is the problem. So why do we need to resort to all of these diets?
Yeah, it's not a temporary thing. No, it has to be a lifestyle, one that you're going to stick with. It's not like I'll go on a diet now, and then after you lose your 100 pounds, you go back to your old habits, and then you will gain 200 pounds.
Exactly. So people are into wellness, but without realizing that wellness is a process. It's an entire process that it is evolving.
Hindi
and it's
wellness
not one
kasi
time.
is uso eh.
But the problem is,
in the Philippines kasi the emphasis is always pampaganda.
Yes. and it's not sustainable. That's a problem. So, and consistency also.
Yes.
Among our, well, me, I'm also guilty with that one. So, I love to eat. So, as a Filipino, I love to eat. I love
we
sugars.
all want a quick fix.
Yeah, we'll always have reasons why we eat. For
Yes.
example, we are so stressed out with work.
Yes.
So my reward would be I'll be eating cakes or ice cream, which I'm also
Yes, and
guilty
also
of.
in the Philippines, you cannot have a meeting where food is not served.
Yeah.
Parang if food is not served, it didn't happen.
Or
It's
mainit
not
ang ulo ng
serious.
mga tao.
So,
Without
parang
food.
if you want to make a deal, there has to be food.
So if you go to other places, it's Filipinos are shocked. This is buffet to you, but Filipino buffet is kind of different. So it's a whole lot of serving, a whole lot of choices. So that's why this habit and this type of, in a way, embedded in our culture actually affects the wellness, the health of Filipinos now.
Yeah, because, growing up in a Filipino family, we don't greet each other with, "Hoy, kumusta ka na?" We greet each other with, "Kumain ka na?"
Yeah.
And then, everyone is forcing food on you.
And
And
when you
speaking
get
of forcing food on you, can we offer you something to drink?
Water would be
Gamba,
fine.
please, water. This is our assistant, Gamba. He's
Thank you.
obviously healthy. Yeah, so what are the major causes of mortality in the Philippines?
if you look at in the past, when we are trying to improve healthcare system, because in the past, let's say for example, for the last 20 years, it would be communicable disease, so infection. So before, people are dying from
Like what?
TB, pneumonia, but right now, they're more onto non-communicable diseases or lifestyle-related illnesses. Like hypertension, obesity, diabetes. You have COPD also, or chronic obstructive pulmonary disease. So this
What's
is
that?
caused by...
What's that? That sounds...
scary.
Yeah, what's
that? So it's often found in among patients who are chronic smokers.
Oh.
So COPD patients, so more and more Filipinos are dying from these diseases as compared in the past. This has something to do with the habits of the Filipinos now, affecting significantly the morbidity and mortality.
What's the difference between morbidity and mortality?
Mortality is death. Morbidity is, it can be debilitating, a patient can be hospitalized, can cause a significant
Something
illness.
Eventual.
Yes, it can lead to mortality
Yes.
if that patient would not take care of himself or would not take the appropriate medication or intervention.
Yeah, and given that, our culture is so rich in sugar, I would think that diabetes rates are through the roof, huh?
Actually, you can look at the lifestyle of the Filipinos. So we've mentioned that Filipinos are working hard, working in the wee hours of the morning. So what do you do? What's the tendency of Filipinos while they're spending so much time working?
Eat late at night.
Eat late at night. So what happens? So when you're sleep deprived, so your hormones are erratic.
Yeah.
So you have your hunger hormones, which are shooting up, and then your full hormone, you call it leptin, are very, very low. So your tendency is you feel hungry. So you eat and eat and eat and eat. And then your hormones that controls your blood sugar are also affected. So that's why the rate of diabetes is quite high in the Philippines also. So stressful lifestyle, lack of sleep,
Yeah, so
poor eating habit.
everything is linked. I feel that there is an epidemic of sleeplessness
Yes.
all over, especially in Metro Manila where, people are paid to be sleepless because they work at night.
Yeah.
Yeah, so what are the immediate consequences of sleep deprivation?
So this so-called internet addiction,
Yes.
we can call it internet addiction, it's the growing epidemic nowadays. So if you look at the Philippines, we're a bit slower in terms of internet adoption.
Yeah,
So,
because our
the
telcos
technology.
suck.
Yeah.
Yes.
So as compared to the other markets.
Yeah.
So but then again, smartphones are cheaper. They're coming cheap. There's so many
Yeah.
gadgets. So
Yes, and I know people who just cannot be away from their phones.
yes, all the
And they
time with
feel
the phone.
physically ill if they don't. And then they just keep scrolling. It's like they can be reduced to a finger just doing this the whole day.
Yes. Existing with just the phone,
Yes.
not even talking to anyone but the phone.
No, and then you're talking to them, but they're looking at their phone.
Looking
They're
at
not
the
even
phone,
acknowledging
so-
your existence. Yeah.
Do you call it multitasking? I don't know if it's
No.
multitasking.
I think they're just being rude. Anyway, yeah.
Anyway, so that's one factor also, no? So you're the internet addiction or exposed to gadgets.
Yes.
That affects
Yeah, and
your...
di ba blue light, it keeps you from falling asleep.
Actually, if you want to sleep, then throw away or put away your cell phones, your
Yes.
gadgets.
I
The
tell
television should not be in the room, actually.
As in, turn off phone and computer and TV 2 hours before you go to bed and read a book. No one believes me.
So what happens when you're sleep deprived? So one loses focus, concentration, more emotional. You can't think logically.
Yes,
You
and
make-
not to mention that lack of sleep leads to anxiety and depression.
Exactly. So all of these are interconnected with each others.
And the thing is, I feel that most people know what they have to do. They have to eat healthier, they have to get more sleep. But the feeling is they can't because this is the work cycle. If you want to continue to be employed, you know, in a capitalist society, of course, you know, you are the work you put in. And so,
It becomes a cycle. So if you really want to go into a healthy lifestyle, so we said it's a process and it's an evolving process. Well, the first thing is to recognize that you are not in your best self, meaning your emotional being, mental, physical being, they're all in a haywire. And so what do you need to do? You recognize that there's something that you have to address.
yes.
And then commit to doing the things that you need to do.
And that you're going to have to change your entire life because this is like something you'll do for the rest of your life, not for 3 weeks.
We're not really addressing the root cause. We're not really addressing what we wanted to happen to our life. So really, it's understanding wellness per se is not just the absence of illness, but the totality of the person.
Could you give us like a basic checklist? As in, how do we know that our health is okay? As in, short of going for the annual checkup, how do we know that we're okay? I'm guessing the ability to sleep
So
7 to 9 hours a day.
Yeah, so actually there's a recommended number of hours of sleep for adults. For us, it's at least 8 hours of sleep. So for children, it's more than 8 hours, so up until 16 hours. So, and all the while, we thought that those short naps in the car would actually help us to compensate for that lost sleep with just those short naps. We call
so-
it power nap.
Yeah, it has to be 8 hours continuous.
Continuous.
Not 8 hours, not 20 minutes here, 5 minutes there.
Yeah. It should be a continuous sleep, uninterrupted sleep, restful sleep, for us to really regain our health, mental and physical health.
And so, other signs that your health is okay.
So when you're able to perform your day-to-day activity,
Yeah.
so you're able to function as, for example, you're able to go to work, your disposition at work is also at its best. Because when you talk about health, it's the social, mental, emotional well-being of a person.
Okay, so now hospitals. We always have a conflicted relationship with hospitals because una-una, people are afraid of the pain, but more than that, people are afraid of the horrible expense. So, when should we go to the hospital? Because, you know, some people, they should already go, as in practically naghihingalo sila. Hindi, kaya pa to. And then others na konting hatching, nasa ospital na. When should we go to the hospital?
So your body will tell you whether you need to go to the hospital or not. So, but the thing with the Filipinos, until the time that the condition is severe, so they will not see a doctor, and they tend to be anxious. So what would they do? Instead of going to a doctor, they ask a friend who might have a different illness in the past, but because they have the same manifestations or
Exactly.
symptoms, that you would be thinking,
And then
oh,
not considering that everyone has a different
Yeah.
body chemistry.
Yes.
No, and then somebody told me that it looks like most Filipinos get their information from the counter people at the pharmacy. As in,
There's a-
pupunta ka sa drugstore and then you tell the clerk, yung ubo ko 3 days na, anong dapat gawin ko?
That's also our problem, no? We're educating our healthcare providers also, like the pharmacists, not to, because it's some sort of a consult already.
Yes.
That should be done in clinic. But the sad reality of which is there can even be switching of medicines.
Yes.
Because the pharmacist would have that liberty of telling the patient, oh, you take this better than this one, this is better than this one. So, which is, we are discouraging our pharmacists, our colleagues from doing that. Of the patient.
Proper consult, of course, is an excellent idea, but are there enough doctors?
So that's our problem.
And also, can people afford them?
So on an average Filipino, we keep on telling that they spend so much on food, but really not so much on the health. And I mentioned that they would only go see the doctor when their symptoms are already severe.
Yes.
Or would resort to Googling.
Mm-hmm.
So, but that's bad. When you try to Google a symptom, so most often than not, Google will tell you, oh, you're going to die in a few days, or you have cancer, or you have a terminal illness.
Yeah, if you're imaginative, of course, you will think the worst.
Yes.
Yeah.
But I agree with you that it's actually a problem of our country. We don't have that much number of doctors who can see these patients. So
Yeah, I guess was this for starters, we can educate the public about the basics. Like, number one, antibiotics, you just don't prescribe them to yourself because you heard about them, and you don't decide that this is for you and start taking it.
Exactly.
Yeah, and then for my generation, our parents had such faith in the powers of vitamin C.
Actually, you can get vitamins from the food we eat.
Yes.
If you have a balanced diet, that can actually help you combat
And that's the
diseases.
problem. We know that we don't have balanced diet.
Studies have shown that there's some benefit when you take it for particular instances. For example, there's really a deficiency of, you have a deficiency of vitamin C, vitamin B. So taking in vitamins would actually help you. But taking mega doses of vitamins can actually also lead to serious adverse reactions. Your body doesn't need it, so where will it go? So it
At the
can
very
affect your
least,
liver.
it's a waste of resources.
Yes, waste of resources. So
Yeah, and speaking of vitamins, you know how because everyone is trying to be whiter,
okay.
or they're trying to get better skin, and everybody says, oh, don't go out in the sun because ultraviolet rays damage the skin, etc., etc. We avoid the sun, so I feel that there's a massive deficiency also of vitamin D. Yeah, so
Exactly.
what's the recommendation now?
Putting yourself under the sun or getting a strolling during lunchtime can help you boost your immune system, and ergo also your vitamin D supply is being replenished in the body. Again, you don't need to take in so much of supplemental vitamin D when you're able to have enough exposure to the sun.
Yeah, like, so what time is safe? Because we were always told growing up, don't go under the sun between the hours of 10 a.m. and 2 p.m. And then recently, somebody said, no, it's noontime when you should go out. So what is right? And
Or
if
a
you're...
good sunlight exposure is especially in the morning, around 6 to 10 o'clock in the morning. So that's nowadays we really couldn't say which is the safest because of all of these things
There are
happening in the
conflicting
environment.
studies, yes.
Yeah. As long as you have enough exposure to the sun and you don't confine yourself to your rooms, so that would be good enough and will help you replenish your vitamin D in the body.
And then, so what about commuters? Because, given the horror of traffic these days, commuters are stuck in a vehicle with a bunch of strangers. Who knows what germs those people carry? What are the basic things that commuters can do to protect themselves from getting infected with whatever their fellow passengers are carrying? Especially since my parents' prescription just take your vitamin C and you'll be fine, might no longer be correct.
So we need to protect ourselves, so we can wear masks. Or if we have cough or cold, we should know the cough etiquette, or cough etiquette also. Cover your nose, cover your mouth when you're coughing. Also, to frequently do hand hygiene
And then, of course, it's the rainy season, and it's dengue season.
Yes.
So, at what point should we worry about dengue? Because I know very worried parents. Their child has a slight fever. Immediately, they rush to the hospital. Now, it could be dengue.
For dengue, the fever of dengue is really persistently high.
Ah.
So the usual pattern is it's 5 to 10 days of fever, persistent high-grade fever. And then...
And of course, parents don't want to wait those 5 to 10 days.
So they're not faulted. So when they come to the hospital, there are certain tests that could actually help determine whether the child has dengue or not. For us, we also say that not all cases of dengue need to be admitted because we look for what we call as warning signs. So what are some of the warning signs? So that's dengue fever. So the fever plus, for example, abdominal pain, vomiting, patient is unable to drink. So that's the time that we advise admitting the patient in the hospital. So for dengue, there's no treatment for dengue. So it's just fluid resuscitation. We call it fluid. So and monitoring. So for parents, it's okay if at the first onset of fever that they bring their kids or themselves and see a doctor for them to be properly advised. So because for dengue, some of the symptoms may be very non-specific. A patient can be just coming in, they were thinking it's just a sore throat or just coughing, but eventually it turned out to be dengue. So it's really best to go to the doctor and have the doctor examine you or your kids.
And maybe try to dengue-proof your house, as in don't have standing water.
So that's the best way also. Best way also is you can put on anti-mosquito lotions. So the studies that we've made and the researches showed that it's the one that contains DEET.
DEET?
Yeah.
D-E-E-T.
D-E-E-T that has been proven to ward off the mosquito. So it can actually help your kids or yourself from getting mosquito bites that could be actually be dengue.
And of course some years ago there was the dengue vaccine that was introduced, but then it was completely politicized, so that has just imploded. So now even if it can do you good, there's always the hesitation.
Yes, and it actually did not only affect the dengue vaccine, but all the other vaccines as well.
Yeah, especially in the US, there's the whole anti-vax movement. Yes. As in, I think New York City has banned children who are not vaccinated from attending schools because you're going to you're prone to certain diseases that you could pass on to your classmates. Is there any sort of is there a similar movement in the Philippines, some anti-vax movement, or?
So there
it's not exactly a movement.
It's not actually a movement, no, but not as loud as those in other countries. But we do get a lot of parents who do not want their kids to be vaccinated for several reasons. One is because of all of these brouhaha of dengue vaccine. So they fear that their child might get adverse reactions also from other vaccines that have been available in our country for the longest time. So that's why you have resurgence of a lot of vaccine preventable diseases. Another thing, the factor that they will be telling is the unavailability of the vaccine also in their locality. Or a simple reason is that they don't want to go because there's nobody to take care of the other kids. So simple reasons such as that could actually lead to, we call it vaccine hesitancy, not actually an anti-vax, but hesitancy to vaccination. So
I remember when I was in grade school, we had no choice but take our polio vaccine because it was the school that issued it. So maybe the school should be in charge of this. Hopefully,
we will be able to have more healthcare workers involved because that's a problem. We do have the availability of the vaccine, but if there's no one to administer it correctly, to the children,
Right.
then that's going to be another problem altogether. We are going to avoid all of these diseases, this hospitalization, if we take action. So it's prevention more
Yes.
than cure. So before the problem sets in,
Yeah.
we have to act on it.
Yeah, it's like for most instances, you don't need medicine. If you're taking care of yourself, you won't be needing the
Exactly.
medicine.
So that's why we don't stop educating,
Mm-hmm.
and increasing disease awareness. So there's a whole lot room for educating our Filipino countrymen.
Last question, since we're concerned with maintaining our sanity in stressful
Okay.
times. With so many health issues to worry about, and I'm sorry if we just gave the viewers new sets of health issues to worry about, how do we maintain our sanity and not, give in to anxiety over health and medical issues?
So anxiety, actually, for some people, it's protective. Eh. So when they're anxious of something, they're protecting
It
themselves.
forces them to act.
Yes. So, but the thing is, we have to stop from Googling. That's basic thing. Or you feel this, you feel something, and then you Google that. I feel lightheaded. You try to Google it. and then
Sometimes hypochondriac na yan.
Yes.
Yung it's like, you just want an official name for what you think your symptoms are.
Yes. So, and you try to fit it whatever you see. Oh no, I'm dying of cancer, or I'm terminal. So what will I do? Things like that. So stop asking friends. For example, you feel that you're consulting a friend who just had the same illness or the same symptoms that you have. So it's okay if you ask them what that person felt when she had the symptoms, but not to the point of taking also the medications of your friend.
Or maybe you could ask them to refer you to the
The
doctor who solved the problem.
The best way still is to, when you feel that there's something wrong, again, your body will tell you that there's something wrong. You go see a doctor. So there's so many doctors who are more than willing to help you understand what's happening with you. Also, because we said that all of these diseases are technology related.
Basically, just, take your life back from the machines.
Yes. I'm pretty sure we know all of these things. We know what's wrong with us. We know that what is necessary for us.
We know we need to get more
Yes.
sleep. Yeah.
But we need to commit to change our lifestyle.
Yes. Stop saying, wala akong magagawa, ganyan talaga yan. Meron ka
Yes.
talagang magagawa, but you have to commit.
It's a personal choice. Wellness is a personal choice. So it's an evolving process, but you have to make the decision, you have to make the choice. So sometimes when you make the choice at hindi rin siya tama, then you have to accept it and then move on.
Yes.
So it's
As in, learn to forgive yourself.
Yes.
Yes.
Do not be too hard on yourself.
Yes.
And I think this is achievable. You don't need expensive food, or you don't need to spend so much on
As long as you take care of yourself.
Again, it's a holistic approach to management.
Yes.
So you look at the physical, not just the physical, but the mental, social, spiritual, emotional well-being of a person, for you to be able to say, I am healthy, I am well. So it's not just merely the absence of disease.
Yes. So, thanks very much, Dr. Jing. That's
Thank
very
you.
informative.
Thank you very much, Jessica.
I
Thank
will
you very
try
much.
to.
Me too.
Okay.
Thank you.